All right. So thank you very much for attending my presentation. My name is Alexandros Sofias. I come from RWTH Aachen Uniclinic. And I would very much like to thank my lab for inviting us here today to present our study. So what we are doing in our lab, we have various nanomedicines, and we really like to understand how do they behave in vivo. And for this, we typically use optical imaging at different levels of spatial and temporal resolution. And what we traditionally do is that we have nanomedicines, we are labeled with fluorescence, and then we inject them in tumor-bearing mice. And we use different imaging modalities, for example, FLTCT. Then at the lower level of tissue resolution, we have real-time microscopy and also further analysis with histology, immunohistochemistry, and so on. Yesterday, during the image-guided drug delivery study group, we analyzed a lot the techniques that allow us to visualize real-time the interactions of different nanomedicines with immune cells. Today, I would like to focus on the first, the FLTCT applications. So, how we are using FLTCT and what we can get out of it. We can receive a very nice, structured CT signal where very easily we can segment all organs, and by taking all those slices and together with fluorescence, we can have very nice 3D reconstructions, and then we can localize fluorescence with given organs. And the most common application we have is to identify whether our nanomedicines are targeting primary tumors. And we have this example when we have here a free dye size 7 that we can see that at early time post-injection, around 4 hours, is localized mainly, here is the liver, and and here in the tumor, which is in this area, we do not see anything. Then at later time point, at 48 hours, all the free dye has been cleared out. But when we go to size 7 labeled mice cells, we see that at around 4 hours, the targeting of the liver is low. This means that the nanomedicine is still in circulation. And then at 48 hours post-injection, we can see that it localizes in the tumor. And then, when we are taking into account all organs and we quantify exactly how the fluorescence is distributed, we can very nicely follow. Here is a pre-scan, and then we have at 15 minutes, 4 hours, 24, 48 hours, and we can see, for example, in tumor that the free dye doesn't target the tumor, but when we are answer it to the mice cells, we see how the mice cells nicely target the tumor. And we can also see the signal from the heart, that is indication for the long circulation time, and we can see that the dye that is answered to the mice cells circulates longer. And this study, we published it approximately a year ago, and we have at the MI Labs website a webinar about it, so if you are interested, you can find more details there. But this is how traditional nanomedicines behave. So we have some further experimental molecules which we don't know how exactly would behave in vivo. For example, we have this immune system engager, which is a small molecule that you can see that composed of those binders that they are meant to target cancer cells. And then they have another moiety here that is we call effector. And what it does is that as long as this molecule binds to a tumor cell, attracts phagocytes and then enhances the phagocytosis of those cells. But this is a small molecule, so when we are injecting that IV, and you can see very nicely what also Dr. Beckman mentioned before, that we can very easily distinguish the signal between tumor and bladder. So when we inject these small molecules IV, we can see that both the scrambled molecule and the actual either, they go to the bladder. And you can see by the quantification that we don't achieve any tumor targeting. But when we are having proximal to the tumor and the proximal lymph node injection and do this application subcutaneously, we can immediately see that both the scrambled peptide and the real peptide, they can target the tumor. And this is very important here to realize that both of them, they have equal tumor targeting, which is a very positive thing because the scrambled peptide, like both peptides, they are physicochemically similar, but this one is biologically not active. So we are expecting it to have a way, like an easy way to the tumor, although the immune system engager might meet other immune cells in the way to the tumor, and then of course the targeting would be lower. But it's very positive that we don't have any actual differences there. Another application, since the FLTCT device allows us to monitor small changes in the fluorescence in the tumor microenvironment, and we have this nice project that exactly reflect that. So our goal in this project is to cause in the tumor microenvironment and vascular promotion such that we increase the vascularization for a very short amount of time, and then inject the nanomedicines and allow the nanomedicines to localize in the tumor more. And for this application, we use DMOG, is a pharmaceutical compound, and after we have pre-treated the mice with it, we inject our mice cells, and then we monitor with FLTCT the tumor targeting. And we see the untreated versus DMOG-treated mice. So this here, the tumor microenvironment has been primed. We can see much nicer mice cell accumulation. If you are interested in this study, I would like to redirect you to poster number 600. My colleague Asma El Safei will present this entire study. And then another very important application is, so far I have been talking only about tumor targeting, and of course tumors like the blood pool in the tumor and the consistency of the tissue allow for us to very easily quantify the fluorescence. We have nothing to disturb. But in other organs, for example liver, that they absorb a lot of light and there is like very big amount of blood in them, traditionally we have problems in quantifying fluorescence. But what we can do with the FLTCT is that we can have tissue-specific corrections, and therefore the reconstruction of the liver can very nicely give us the actual fluorescence that exists in the liver at a certain point. And in our study, we synthesized 3 different nanocarriers, like mice cells, liposomes, and microbubbles. And by quantifying the signal in the liver, we can see the mice cells target the liver at higher extent than the other 2 nanocarriers. And then if we correlate these findings with flow cytometry, we can see that completely agrees with the evidence we got for FLTCT. And mice cells, for example, they are taken up by hepatocytes and Kupffer cells much more than the other 2 nanocarriers. And what that is important is that FLTCT, together with other traditional experimental modalities, we can have the signature of where each nanoparticle goes, in what kind of cell type. And for and this study is like it's a large study. I just saw a very small amount here. Many colleagues of ours have contributed. I would like to redirect you to Mr. Jan-Niklas Mai and Mr. Anshuman Dasgupta. They have parallel sessions, number 24 and number 11. So if you are interested in our work, you can attend their presentations for more details. And a last thing, that's something we extensively also discussed yesterday, is related to novel therapies, that they are not focusing in targeting the organ macroscopically, but to target specific immune cell subtypes within these organs. And one major application here is the ability to target, like to deliver nanomedicines in the bone marrow. And of course, we have seen many groups are trying to not just to target bone marrow for diagnostic purposes, but also for therapeutic purposes, and polarize in a specific way progenitor monocytes. So what we do with the FLTCT, that is something that is new for us and in general for the field, is that we try, based on the 2D CT and the accurate segmentation on the bone marrow, and of course the 3D reconstructions and the FLT signal, we can very nicely design nice 3D ROIs in the bone marrow and really see how many nanoparticles have targeted this area. And by quantifying it, we can see a comparison between a free dye and a size 7 labeled nanoparticle, and we can see that the nanomedicine allows us to target the bone marrow. Same story here for spinal marrow, and we see even higher targeting in the spinal marrow. And the reason that another important information about like the ability to quantify with the FLTCT machine very well is that you see here overall the spinal marrow has more uptake of the dye, both the free dye and the nanoparticles in comparison to the bone marrow. And the reason is that these particular mice are older in age. So the hands and legs of older mammals, they are only structural. The bone marrow there is not active anymore. But in the spinal marrow that is still active, and we have a lot of inflammation and hematopoietic process there, that's the reason of having like better signal, better targeting in the spinal marrow. And this concludes my talk. So here you can see how easy it is for us to apply the FLTCT. Here is my colleague Ilaria Biancazzi. So it takes us approximately 15 minutes to complete a scan from 0 to 100. And the software is also very user-friendly. And that's super important also for multidisciplinary labs composed of biologists, pharmacists, medical doctors that we don't have like very broad knowledge in reconstructing complicated images. And finally, I would like to thank all my colleagues at RWTH, particularly Professor Tuan Lammers, Professor Fabian Kiesling, also my colleagues Federica De Lorenzi and Diana Mokel, which specifically helped a lot for this presentation, and of course, MI Labs for inviting us, and thank you very much.